We have a variety of ways that we've found choosing a patient experience advisor. We started off by going through the patient relations specialist. So she deals with people who have had complaints with the hospital. She also deals with people who have had good experiences at the hospital. So the first few people, the first two people, I got names from her. One person had had a fine experience. The other person had a really quite a traumatic experience from her perspective. And we didn't shy away from people who had negative experiences. We decided that what was more important was that they could see beyond their own experience, that they were able to sit in a group and hear somebody else's experience also, that they didn't have an axe to grind. And so we accepted those first two people, but the other two people were folk that I had come across as my position as a chaplain. And so these were people I'd been working with in the hospital who really wanted to better the experience of patients. And so I contacted them and asked them if they would like to be part of this new initiative around patient and family-centered care. And they jumped on board, and that's how we got the first four people. Since then, it's happened with word of mouth. Patient experience advisors have brought on friends as we've needed to fill in positions. They realized that they knew someone who had gone through an experience at KGH and who had the time to offer and the passion to offer up to us. So that's how we selected the patient experience advisors. And a lot of it was just trusting our heart that this was going to be a person that was going to be able to work with us. The patient experience advisors tell us how our system really works. They're the only ones that can tell us how our system works. They can tell us if they feel safe, if the information they got was understandable to them. They are the only ones that know if tests and procedures were explained well to them. They're the only ones that can tell us if they were respected. So they bring that perspective that no one else can bring. I had one fellow who had just got a cancer diagnosis. He had gone in to see his urologist. He knew he was fine. He wasn't worried, but didn't bring anybody with him because he was fine. And the first words out of the specialist's mouth are, "You have cancer." And he said he sat there for the 15 minutes while the specialist did notes and did diagrams to tell him what the prognosis was like. But he said, I didn't hear any of that. All I kept hearing was the word cancer going through my head. At the end of the time with the specialist gave him a card and said, we need to discuss how we're going to deal with this cancer now. So here's a card, and you need to go to the front desk and make an appointment for 2 weeks so we can discuss what your options are. So the gentleman took the card, went out, and he was standing in a line with 10 people ahead of him as he waited to get an appointment for 2 weeks. He said to me, Daryl, it was so not patient and family-centered. He was very happy with the specialist, and the whole urology clinic were wonderful people, but they had never spoken with the patient to understand how their system actually worked. And once he was able to bring that information back, then they were able to change the system. It doesn't have to be that way. But as far as they were concerned, it worked fine. The Patient and Family Advisory Council is made up of 12 patient experience advisors and 5 staff members, including a senior executive who sits on the council. Any initiatives, any processes that we're changing, anything we're looking at within the hospital is now coming before the council. So the council gets a chance to give their perspective on what's happening. We aim that there shouldn't be anything affecting patient care that doesn't have the patient voice involved in its development. So the council meets once a month for 2 hours. And we usually have a couple of presentations from folk in the hospital who want the expertise from the patient's perspective. Last month we had a systems analyst who came in and spoke to us about a medication reconciliation documentation. And the council had some great feedback for him from their perspective. Another person who came in was our professional practice leader for nursing, who spoke to the council about security issues at night. And again, the Patient and Family Advisory Council had a perspective that the hospital as an organization had never really thought of. We just were coming at it from different ways. So they look at all of these issues coming. I was worried when we first started the council that we wouldn't have enough items on our agenda, and that's never been a problem. We have the 5 staff members who sit on the council are very active in taking those items back to the appropriate committee. So if something comes up that needs to go back to infection control or whatever, then we make a most responsible person who's going to take that back to infection control and say the council has this concern or the council has this understanding. And so it works both ways. The council comes up with ideas. They don't just receive information. They also come up with things. We were dealing with a C. difficile breakout, and as we know, hand hygiene is really important. So the council suggested that the corporate hand hygiene compliance rate be posted at the front doors of the hospital, and then on each unit as you go in, that unit would have its compliance rate for that month. So when you go into the hospital now, that's exactly what you see. So the patient experience advisors feel it's transparent. They know whether they need to be checking on that resident coming in that she's washed her hands or whatever. So this is something that really a lot of the staff were sort of aghast at seeing an 80% hand compliance rate stuck on their unit. And so what it's done is it's really made them pull their socks up, and they want to have patients seeing that they do 100% hand hygiene. So it has wonderful ramifications all around. There's a patient experience advisor on our patient quality of patient care committee, which is a board level committee. And that I don't know of any other hospital who has a patient experience advisor at the board level. We aim to have a patient experience advisor wherever decisions around patient care are being made, so that their voice is there from the beginning, not just a fait accompli coming to the council to be rubber stamped, that the patient is part of the decision making from the very beginning. And that's the heart of it all, I think. So they're on all our 9 program councils, have at least one. We aim to have 2 advisors on each of our program councils. Any task force that's coming out, we ensure that the patient voice is going to be present at the table. That's been a wonderful, that was a great idea, and I'm not even sure where it came from, but to have a patient experience advisor sitting in as a nurse is being hired, and to be asking very specific questions around what's patient and family-centered care to you? How do you include the patient and the family in what you're doing? How is your care plan created in partnership with the patient? If you've had in the past, tell me about a time you've had a conflict with a patient and how you resolved that when you had a difference of understanding. So some very specific questions regarding patient and family-centered care. So it's been fascinating. So what's happening now is people coming into interviews are saying, oh, they've got a patient experience advisor on there. And so they're understanding that this is part of what KGH expects from its employees, that they are going to be patient and family-centered. So our hope, of course, is as new people are coming into the organization, these are going to be people who are already thinking in a patient and family-centered way. So, over years, that's going to make a big difference for our organization. The hand hygiene compliance, that was something that came from the council and was acted on. There are so many, I'm certainly not going to be able to name them all, whiteboards at the foot of the bed. The patient experience advisors had input into how that was going to be, what information would be captured there. Signage in the hospital. We have patient experience advisors who help us decide what the signage is going to be and where we need better signage. name tags. So oftentimes the name tags we were using were flipped over, and all you saw was the codes on the back of what a code red was, what a code brown was. And so you couldn't see the patient, you couldn't see the staff member's name or what discipline they were even with. So they came up with a large name tag that simply had the first name and your position underneath. So Judy RN, and it's readily visible, so that when the person comes into the room, the patient can see it. It's even without my glasses, I'm able to see the name tags. It's had several good spin-offs in that. People call me by name more often now. Staff I've worked with for years, but you don't have a relationship, and so I get called by name more often. I'm able to call people by name more often. It's made patients feel safer, I think, and also that they're part of a team. It's not some mystery person who's coming in that I don't know what they're there for or who they are. Makes it more personal. So there's a number of initiatives that they've done. I think one of the challenges we have is around fatigue. We haven't experienced it yet, but I'm afraid of tiring some of our volunteers out, some of our patient experiencers out. They're really so passionate. I had a woman just the other day. I was asking her if she would be able to go on a hiring interview, and she said no to me, and that made me feel so good because up until that point, she had never said no. She was always going to be there. She loves being on the hiring committees, and so she says, just give me a call at the last minute. I don't care. I really want to be part of this, and that's great. And but my fear is that we're going to tire some of these people out, and so it's to be aware of that fatigue, which could certainly come in. Communication around patient and family-centered care and the advisory council. Even though I think we've done a pretty good job about getting information out there, there are still people in the hospital who don't know we have a patient and family advisory council, which just always surprises me. So communication around what we're doing, we need to do that somehow better. Communication within the community, so the community knows what KGH is doing around bringing in patient experience advisors. So those are a few things that I see challenges, and also needing to bring in more patient experience advisors. We have room probably for another 150 or 200. There's so many things, so many committees, so many initiatives that happen within a hospital, so many hiring. I mean, the number of hiring interviews alone would probably consume 20 patient experience advisors just to keep that going. So it's really, it's limitless probably. And I'm just amazed at how many people are out there who want to give back to the organization and who are very passionate about spending time and making it a better experience for others.